let's talk about May and the ISHRS workshop in Florence.
Right. Yeah, absolutely. So, so let's start with congratulating you because you are the program chair for the live surgery workshop of the ISHRS.
Thank you so much for this invitation.
No, you deserve it. Well done. So yeah, the exciting thing about this is that I think, is going to be the first live surgery workshop since COVID.
Yes,
I can't
right.
remember. Yeah, the first live in person, and hopefully everything will be okay because everything is opening up. From this week, the government here announced that all restrictions are finished. So I expect maybe, sometime soon in the rest of the world.
The same in Italy. At the end of March, the emergency period will be over. So unless something happen, we'll be safe for May in Florence. So that's for sure.
Hopefully, because hopefully people from all over the world should be coming to Italy for that workshop. So hopefully nobody gets a problem. So the ISHRS was very keen to hold this workshop in Europe, and because FUE and transplant in general is extremely popular in Europe, so many doctors doing it, so much demand. So maybe you could tell us, what have you got lined up? What kind of what should attendees expect?
Of course. So, like you said, after the long COVID period is the first live hair restoration workshop organized by the ISHRS, and we are so happy to have this workshop in Italy, in the beautiful Tuscany, Florence, and especially at the end of May. So during the springtime will be wonderful, and this workshop will be in collaboration between the ISHRS and the CITRI. The CITRI is the Italian Society of Hair Loss and Hair Restoration. We will have an international faculty. We want people learning from the best surgeon from all over the world, and each surgeon we invited will show a different technique to harvest graft, different techniques to place graft. Now, because the FUE hair restoration became so popular on the market, we have so many instruments, so many devices, and very good devices. So all people, especially beginners, need to watch expert in this field to evaluate the best devices. Sometimes there is not the best devices. There are many devices, and you can choose one of them based on the case, on the patient. So this is a really good chance to see best surgeons from all over the world show all these devices. So we will have also strip surgery, for example. So we want to show literally everything is possible to do to get hair back and to have hair restoration.
Fantastic. Yeah, I mean, FUE obviously is more popular, but the strip, sometimes we do recommend it, of course, still, and it's important to see that. But the devices, I mean, you're right, there is no best device, is there? And many of us have probably a lot of different devices to use in certain cases, and because we're always trying to make things better and improve and discover something new. And sometimes one device works for one doctor, maybe for you, but doesn't work for another doctor. It's just different skill.
Exactly.
But at least it's an opportunity to see.
Exactly. It will be important also for us. We are experts in this field, but sometimes it's very interesting to watch other colleagues working with different devices, so different techniques. And also for us is a way to take a tip to come to take home and to improve our practice day by day. So we put on this workshop with the idea to teach to beginners, to everyone who is interested in start to learn hair restoration, or just to improve this field, so to improve his skills, his techniques, so he's already in this field and want to learn more about other way to do hair restoration. So I will say is literally for everyone who want to know more. And after this long period of COVID, where everybody of us stay at home in our clinic, doing a daily practice for years, now we want to see something different. We want to exchange experience, we want to exchange opinions with other colleagues. So this meeting is important, like other meetings in the past, but has a different value, something more, because we went through a tough period of time, all of us, all world. This absolutely. Is something in common we have.
And don't forget opportunity also to see friends again.
Yes, right. For us, it's like a big family. Every time we travel for a conference or for a workshop, is a way to stay together, to enjoy also free time. Is beautiful for many reasons, and we want new people joining us to make this beautiful experience. Like so we say.
Do you think the workshop then is a good one for beginners as well as experienced surgeons, then, is what you're saying?
Yes, 100%. I'm also curious as well. Even I'm in this field since a long time, and I'm an expert in hair restoration, hair restoration. I'm so curious to see new devices went out on the market just recently, and I can't wait to watch my colleagues showing these kind of devices. In fact, we will have different operating rooms, and in each operating room we will have more than one surgeon showing a different technique. So we are trying to put up everything in the best way possible. So based on what we already organized and we already done, we will have 3 operating rooms. In one operating room, we want to show let's say a new technique, something that I think will become more popular over time. So we will show a long hair restoration. Something
so that like unshaven.
Unshaven, yes, we can say in a different way. So it means that the patient will not be shaven for many reasons. People don't want to change their how you say. Yes, right, their style, for many reasons, privacy, for social reasons, working reasons. So now we have all way to make patient happy. So in this room, in this operating room, we will have a surgeon showing a surgeon from Brazil, our colleague, Dr. Otávio Boaventura, showing his way to perform a long hair FUE. And when we say long hair FUE, we literally say a longer hair shaft FUE. It means that he's going to harvest from the donor area FUE with the longer hair shaft. So nothing will be trimmed, nothing will be shaven. Something amazing, something unique to see. So you will use the Mamba. Mamba is a device made by Trivellini company, and there is a particular punch to do this kind of technique. And I'm really curious to see how he perform this kind of technique. So one by one, so it will be a few, he will harvest all long hair follicular units, and after that he will place the graft he harvested using the sharp implanters. So it will be a stick and place technique. So directly it will
make the hole and then insert the graft at the same time.
Exactly. For all people, it means that the nurses will load this pen, is like a pen. So the name, the technical name is implanters, and it will place the graft in the recipient area, and will be done one by one, and it will place making the sites in the same moment. So sites in place at the same moment.
Sounds amazing. And on the other side of that same room, we're going to have something completely different. Yeah.
We will have our great and super nice friend from Italy, Dr. Vincenzo Gambino. So in the other side, he will show a different way to perform a long hair restoration, but made by strip surgery. So strip surgery is still asked, and there are many cases where it is necessary. So people need to learn both techniques. When I started, and also you, Bessam, you propose to your patient both techniques depend on the case, depend on the request, and
like any good practice of medicine, you need to inform the patients about all the options. But there are particular patients who are more suited for the strip than others, like women or like people who have very advanced hair loss. We do quite a few transgender patients who prefer not to shave. So it's important to know about that. But while you're speaking about strip, just for the people listening, sometimes people are calling this technique different names, don't they? So sometimes people say FUT or linear excision. It's all the same thing. It's not FUE basically. It's removing a block of skin, and then the assistants or the nurses dissect it with the microscopes.
Exactly.
So how will Dr. Gambino then once they produce the grafts, tell us how are they proposing to place the grafts?
Yeah, there are many ways to place graft. His nurses, his team will use the classic technique of placing using forceps. So we have many ways to place graft in the recipient area, and his way will be a traditional but super good and very good technique using in forceps. So it means that you have to be very precise at manipulating graft, place it gently but fast. It's not easy. It will be very interesting to see him working on these both techniques. So strip from the door area and placing graft using forceps in the recipient area.
Fantastic.
And all will be done with the long hair shaft, and the patient when it will finish her restoration, let's say, will be the same before starting her restoration. And he will have more hair in his recipient area. Will be very interested, really. So let's talk about
that was the first case. That was the first operating room.
Exactly.
And in the second operating room, we now going to talk about both two techniques of FUE.
Yes. So in the second operating room, we will operate a shaven. So we will do a shaven case. So the patient, like usual, will be shaved. Will be shaven, and from a side we will have Dr. Nilofer Farjo from Manchester, and she will use.
I've heard of her.
Yeah, you know, for people that don't know all of us, Nilofer is Bessam's wife, and they are a beautiful couple and a beautiful business couple. They have a nice and amazing clinic, reliable clinic in Manchester. So I think it's the best way to work, wife and and the husband working together with the same goals is just perfect, really. And Nilofer is she's the president of ISHRS, so she's a very important person. She's a VIP, let's say that. And Nilofer.
So tell us what she's going to do then. Her technique of the harvesting.
Yes, very interesting. She's going to harvest the graft from the donor area using the WOW device. WOW device is made by the VRA instrument company.
Okay.
Actually, she will show the new device, the new device coming up pretty soon. So something completely new, never been before, and I really don't know how to explain it. It will be like a computer, something very sophisticated. So she will use this punch. I think it is a blunt punch, right?
Yeah, it's a blunt punch, and it's sometimes it's called a trumpet punch. We say like a trumpet, but basically it's got a sharp outer edge but a blunt inside edge, like a lot of the more popular like the punches that are becoming more popular. But the unique thing about this new device, I've only seen it demo, but we don't have it yet, is wireless.
Yes,
so,
right.
Which is different, and we're looking forward to seeing that. Yeah.
Yes, because the device, the old device, let's say old, has a pedal, so you need to push every time this pedal attached to the device. Now we will have a wireless, so a computer, a PC, where you can work on, you can set all parameters, whatever you want, and is literally something advanced. So Dr. Farjo, she's going to show WOW devices, and will be amazing, will be fantastic. We know this device is a great device, and of course every one of us prefer one instrument rather than other one, so depend on our preferences, on our needs, depend on patient.
Yeah, it doesn't make one device better than another one. It's just different, and everybody's got different preferences according to personal choice. Yeah. So that's Nilofer on one side, and who's working with her on that same case?
So in the same case, on the other side, we will have our colleague, Dr. Mauro Speranzini from Brazil. Mauro is a great surgeon, a great person. He's going to show in the same case, so we are talking about a Sheven FUE, a device, a Brazilian device called Beltec. Never seen it. I'm really curious to see this new device, or at least it's new for us, because Dr. Mauro Speranzini is been using this device since years. So it will be something interesting and new. Let's say this is the donor area technique and devices will be used. After that, we will switch to the recipient area. And what happened in the recipient area? Dr. Speranzini will show his own technique, is a special technique where he used to make at first incision in the recipient area with the blade. So with the blade, he likes perform all incision. After that, I think he's going to use a implanter, is a blunt implanters, and he will place graft in pre-made sites using these blunt implanters. I think he used to modify the implanter, so he has his own technique, and it will be interesting to see how he modified the implanter and how he performed this.
I think he originally started doing that, but now I think quite a few manufacturers make these implanters purposefully blunt. And just for people listening, the importance of that is that with the sharp implanter, the doctor has to really make everything because it's an incision. Right. But with the blunt implanter, it allows the doctor to let maybe a non-doctor technician or nurse to place after the doctor made the initial incisions. It just gives more more options. And also some people prefer to make, when I do, prefer to make all the incisions first. It's like
Me
drawing
too.
with a pencil, and then you come back and put the color in a little
Yes.
bit.
What I do in my daily practice is the same. I love doing all incision to have an overview, to decide exactly and precisely the number of graft, and after to place, I place using blunt implanters. In fact, yes.
So that's great. And Mauro has written many articles on the skill in that. So we're looking forward to his work. But also tell us about another interesting device that Dr. Kim from Korea is going to demonstrate.
Yes, Kim, another colleague from Korea, will show literally a new device called ISHRS. ISHRS is a multi-graft implanters. It means that it is implanters that can receive more than 5 grafts. If I'm not wrong, will be roughly 10 grafts, right? So it means it will be something interesting to see, because you can speed up your operation time. So
with one click, you can implant 10 grafts.
Exactly. So we have nurses loading each device, each pen, and each pen can receive up to 10 grafts. So it means that the surgeon, without changing every time implanter and using the same planter, it can place up to 10 grafts. So it means yes, speeding up your hair restoration time.
So far, what you've said, in only 2 operating rooms, we're going to demonstrate 4 different harvesting techniques and 4 different placing.
Exactly. So
yeah, so a lot of things to see and a lot of things to learn in just 2 operating, and we still have a 3rd operating room.
Third operating room. The third operating room will be another shaving case. We will decide if it will be a crown or airline. So it will be a surprise in the same day. And we will have 2 amazing doctors. We will have Dr. Zontos. Dr. Zontos is a colleague. He works he's from Greece, but he works in Vienna, if I'm not wrong, right?
Denmark, Copenhagen.
Denmark. Sorry about my mistake. So in Denmark, and it will show a sharp dissection from the donor area using their tip device. AirTip is a good company, been on the market for years. Nice people, they sell a really good device, and it will show this sharp dissection using the AirTip device.
So this is kind of a classic. This is the classic original way of FUE.
Exactly.
Sharp.
Exactly. I have to say, because I use also sharp dissection, very difficult, because you have to be really precise. You can make a mistake. Sometimes a mistake with a sharp dissection means amputation for graft. Or,
it needs a lot of skill.
Yes, a lot of skills, a good background. So it will be nice to see him working with this difficult device, and I'm pretty sure harvesting a beautiful graft.
And who is going to join him in that surgery?
So in the other side, we will have our colleague from Turkey. It will be Dr. Tayfun, and Dr. Tayfun will show let's say new devices, but actually this device on being the market for years, but they always change, improve year by year. So it's always something new to talk about, to see. So he's going to show the Zeus device made by Umar, Dr. Umar.
Dr. Sanusi Umar from California.
From California. And this device was made, if I'm not wrong, especially for black skin. So it means
African
African skin, African people. So it means with the curly hair. so difficult to harvest. It looks like this device is able to harvest also in difficult and hard conditions, yielding a really good follicular units. And Dr. Tayfun from Turkey is an expert in this device. Both of these surgeons will show also their own technique to place graft.
Okay.
So we will have Dr. Tayfun showing the classic sharp, the classic forceps placing. So it means that he makes sites in the recipient area using a blade. We will see what kind of blade he preferred, the sites. All these details will come out during the operation. We are curious as well to see the decision they will take. And part of the graft will be placed using classic forceps devices, and the other part of graft will be placed with the modified implanters. So he made these implanters by himself. I think is something new. Let's say is a modified kip. Okay.
Yes, just for the benefit of people listening. So the classic implanter, you need somebody to put the graft into the implanter, gives it to you, and then you plunge it. Whereas with this implanter, you can do it yourself. You just like scoop the graft with it, and then you plunge it. So maybe you don't need as many assistants.
Yes, because we have to understand that who practice hair restoration need to speed up the restoration time, if it's possible, so to reduce the number of people, so the team. You know, sometimes somebody get COVID, you know? It happens, so you need a way to work in the same way, with the same speed, and without cancelling a hair restoration. So everything new, everything upgrade is welcome in our practice. So it means that you modify these implanters in a way you can loading by yourself without somebody else loading for you the graft. And this is I found this amazing and curious as well to see him working. And so we talk about Tayfun side. Instead, Dr. Zontos in the other side is going to use a sharp implanter, always by R-Tip company, and it will do stick and place. So it will make the sites, it will make sites and implantation at the same time.
Right. That sounds good. Sounds really good. And then afterwards, we're planning the day after. We're planning a discussion. We're going to have each group to discuss their case and debate the different techniques, and also a chance for the audience to ask questions and discuss what are the best, you know, what works best, and ask questions from the experts as to for tips and sort of hints at how they can improve their technique or learn from them.
Exactly. You can hear me?
I can hear you, yeah.
Yes, exactly. So this is the plus. It doesn't finish just in one day with the operating day, the surgery, but the day after will be interesting to discuss. So will be an interactive meeting where both surgeons and attendants can interact and exchange opinion, experience, question and answer to literally understand in the details the reason why surgeon prefer that kind of technique, why he picked that kind of device in that moment. So will be something more to get inside the surgeon decision. So something important that people can come back home with more information. So it's not just watching people working, but also discussing with them their own way to perform hair restoration. And we are talking about the most important and best surgeon in the world.
Wonderful, wonderful. So it sounds really like a full day. It sounds really exhausting, and I think we're going to be doing quite a lot of work. So there's the two of us. There is our colleagues from the ISHRS Europe Council. So it sounds like it's going to be an enjoyable day, a lot to learn. And of course, that's all in the one day. And for people who are coming to the workshop, they also have the opportunity to come to the CITRI, which is the Italian Society Congress, for the following 2 and 3 days. Isn't that right?
Yes, right. So the following days, the CITRI, so the Italian Society of Hair Loss and Hair Restoration, will organize a conference. So when people from, also there, colleagues from all over the world will talk, will present many topics, surgery, medical treatment. So literally everyone about hair loss treatment, hair loss approach, everything belonging to the hair restoration and the hair loss field. And there will be 2 days of conference held in Florence by CITRI and in collaboration with ISHRS, the European Council. And Dr. Bessam Farjo is the chair of the Europe Council of ISHRS.
So the fact that it's in Florence, that's a massive bonus, because we couldn't have picked a more beautiful city.
Yeah, Florence Tuscany and Florence in springtime will be unbelievable, amazing. So it's the best way to combine job and the pleasure.
So the last time I was at a CITRI meeting, it was very busy. There was nearly 300 people attending in Venice. It was must have been maybe 4 years ago or so. Yeah. So it sounds good. So anybody interested who wants to join, obviously the workshop is only open for doctors, physicians or surgeons, and anybody interested should go to the ISHRS website, which is at ishrs.org, and we'll be posting the link on our Instagram timelines about how to register. But again, if you just look at the ISHRS, at ISHRS, you'll find the links to it. I'm not sure if we missed out on anything, Chiara. Is there anything else we should tell people?
I think we both of us try to say everything about the workshop, and of course more will be shown the same day. And just to say, now it's possible to travel, now it's possible to learn. Why not to join this meeting, this workshop, to learn, to exchange opinion, experience. And if we don't do that, we'll never become better. We'll never change and improve our way to work and to operate. So it's the only way to improve our practice. We know the competition is always higher, and the competition is good because it's the only way to improve ourselves.
No, we have an obligation to ourselves and to our patients to continue to learn.
Exactly.
As even for all of us who are experts, there's always something more to learn. There's always something to pick up, and sometimes by watching you operate or just talking to you or meeting people, sometimes you get invaluable information that otherwise you don't get. But also after the meeting, there is a trip, a trip through Tuscany that people can join, also available on the website. There's a lot of activities. It should be a really lovely trip to combine learning and good fun.
Exactly. Also on my bio, on my Instagram, you can find the ISHRS link to subscribe, to register. So it will be easy if you want to check. And I can't wait. I'm so excited to join this meeting, to meet my friends, my colleagues, and to see all of them working on something new. Also to me, to learn something different.
Well, Chiara, it's been an absolute pleasure to have you on this Instagram Live. I think this is my first Instagram Live, so I can tell you,
great. You were great. You did perfectly, better than me, and I did something in the past.
Fantastic. You have a wonderful evening, and we'll speak to you soon. So thank you, everyone. See you again.
Thank you, everybody listening us, and please join us. We'll will be amazing time in Florence all together. Thank you, Bessam.
Bye.
Thank you. Bye-bye.
Bye.
Bye.